Hey, welcome to the neighborhood. This is the RSPS version of MTV Cribs. It's like MTV Practices. Come on in. So I'm Dr. Zwade Marshall. I am the founder and chief medical officer for Regenerative Spine and Pain Specialists, and this is our practice. We're really proud of it. If you look this way, it's meant to feel like you're walking into a garden. Light, bright colors. A lot of pain patients are used to going to their doctor's offices when it's dark and dreary with old dingy carpets and worn out couches. We wanted this to feel like a place of restoration, and so our designer, Mark Wilcox, giving Mark a shout out from Wilcox Design Group, helped us to create these hand stenciled custom panels with LED backlighting that gives the illusion of entering into a garden. We've got the rock wall, like most spas have, for a sense of relaxation and restoration. If you come this way, this is our administrative offices. We have the nurse practitioner spaces here. On this side, and that's Erin and Monica. They both kind of hang out here when they're not seeing patients. The break room for the staff is on the right side over here. And our clinical labs over here, we do urine drug testing on site and COVID tests as well. And you'll see here, samples are being done and tested right now. So this is the hallway to my office. Again, more of the same kind of custom panel work. Pretty large space, nice and kind of laid out in a way that I find it to be a pretty easy place to be because I spend a lot of hours here. And so artwork was procured by Mark Wilcox. Again, that's Linda Yee out of New York. Wallpapering. I had initially a photo of a beach on this wall, but it looked kind of cheesy. I was hoping for it to look relaxing, but it didn't. It just looked like I was not at the beach. It reminded me that I was not at the beach, and so I had to remove it pretty quickly. Come this way with me. We'll walk into the actual foyer, or foyer in French. Jessica's laughing at me. That's Jessica, guys. She leads all of our marketing and she's being camera shy. So this is the actual waiting area, and this space always had good bones. High ceilings when we moved in here, but the challenge that it posed for us architecturally from an engineering perspective is sound, the acoustics. If you stood over here as a patient at the check-in desk, the sound echoed across the room, and so anyone sitting here in the waiting room can hear all of your HIPAA information. So to counteract that sound challenge, we built this lip to break up the sound barrier there. We ordered this custom fabric chandelier that is directionally focused in the center of the room for sound absorption. And if you notice, all the furnishings are high density velvet so that there's more sound absorption happening there as well. The chairs are high backs. It's meant to feel more comfortable for patients that'll have a hard time getting up out of chairs and standing up. Again, Linda Yee's work, we found that art with themes of nature and animals help to relax and calm anxiety and depression in pain patients. And so we wanted to have the artwork also reflect that motif and aesthetic. I used to have CBD gummies on this display shelf, but they disappeared. I don't know why they disappear. I don't know who takes them. I think it's the staff, not the patients, because they all seem pretty happy when they're at work. It's a circular floor plan. We go in and out and around. Here is the director of operations, Tanya. She may have done another video at some point in time. That's my partner, Dr. Jennifer Zhang, Harvard grad, former chief resident, better version of me. And then we walk around here. The exam rooms are pretty simple. It's meant to be simple and kind of clean and easy. I think the thing in here to note is that we have these screens that we will cast all of the MRI findings. And so patients get to see the actual pictures of their insides of their spine and their spinal herniations while we do the consultation with them. And so we educate them on what the findings are exactly in there. And then after they're seen in the room, they circle out and around, and it's all meant to be circular. So it's a clockwise rotation. It's the appropriate feng shui so that there's no crossing paths through the halls. So patients all come in that way and then they exit this way. Again, more art, and that leads out to the front desk and back into that main hallway that we were just in with the rock wall. Voila. I'll show you the ASC real quickly. So now patients don't actually get to the surgery center using this hallway that I'm going to show you right now. They go around to the front and there's a separate waiting area and a separate check-in desk for the surgery center. But this is my kind of cheat corridor, so to speak. And look, Jessica's following me. She's got a camera. These are all state certified compliant bathrooms with the handicap grill, so you can rub your finger across here and know that you're in the men's bathroom, not the women's. Or gender neutral, you can use anyone depending upon your gender preference. And we're now standing in the pre and post-operative bay for the surgery center. So if you can imagine a busy day for us, we would have patients seated in all three bays waiting to be seen. And our lovely charge nurse, Laura, who we're gonna just jump in on, is sitting over here doing administrative work for us. Hi, Laura. Hi. This is MTV Practices. This cameo, Laura. She's awesome. In here is the sub-sterile room. Now, the tricky part about an operating room in a surgery center is that the HVAC is probably the most expensive kind of engineering bit when you're constructing a surgery center. The flow of air is critically important to sterility. So in this hall, this is a sub-sterile hall, it's all negative pressure, airflow, and in the OR, it's positive pressure. So the ill humors from the operating room are pushed out and then sucked into this hallway to make sure the OR stays sterile. Got our lead vests for radiation safety to protect your precious jewels, to ensure you preserve fertility and organ function for all of our practitioners. And then this is the OR. In all of my life, in training at Emory, also when I was at Harvard, and my previous employer, I've never had an operating room with windows. So you'll be in the OR all day long and you don't know if it's raining outside, if it's suddenly dark. And so I wanted to ensure that I was able to see the outside world from the OR. It just helps with mood for me and for all the team that works with me in here. And so this is the first OR that I've ever been in that has windows. This is small, simple things in life that tend to make us happy. Windows make me happy. And then finally, I'm gonna walk you all to the consultation room, which is where we have patients do their consent documents. And this is the lovely Christina Aguilera. Her name really is Christina Aguilera. It's not spelt the same. And she can't sing, or can you? Can you sing?
No, I cannot sing.
But this is Christina Aguilera. She does all of our scheduling for our procedural side of the practice. That's our consultation room. We've got a little bit of art, a little bit of plants, greenery, again, nature themed. We do consents in here. We explain to patients exactly what they're getting done before they go back to the operating room for their procedures. And then we've got a miniature version of a waiting room, much like the large version across the hall, which is where the family members for our patients will wait. We serve them coffee, sparkling water, soda, while they wait for their loved ones to be done with their procedures. And that is it. Get out of my house, my practice. Thank you, MTV.